Evidence-based medicine (EBM). EBM is a practice in which the physicians use the result of earlier patient care research and other available evidence for making clinical decisions. It is defined by Atminan and colleagues as an approach to decision-making where clinicians use the scientific evidence to support their therapeutic decisions. ABM uses the best existing evidence from the clinical research for making clinical decision. ABM is a 4-step process. पहला क्या है प्रोसेस में recognizing the information needs and frame them as a answerable question. Second है searching for the best evidence to answer these questions. Third है assessing the validity and usefulness of the evidence. Fourth है applying the results to make clinical decisions according to the patient's situation. तो हम लोग पहला देखेंगे recognizing the information needs and frame them as answerable questions में clinicians frame a patient-centered question based on the needs of the patient. A well-framed question includes the following components. Components इसमें कौन कौन से हैं? तो पहला है patient और problem, दूसरा है intervention, तीसरा है comparison, चौथा है outcome of interest. इन चारों को मिला के जो एक्रोनिम बनेगा उसको PICO कहेंगे. The acronym PICO is helpful to remember these 4 elements. अब सेकेंड है searching for the best evidence to answer these questions. The best evidence can be obtained from first colleagues, expert clinicians or healthcare professionals. Second है from textbook or practice guideline. From electronics database of systematic reviews. Fourth है literature research using database such as Medline and PubMed. Medline and PubMed of the National Library of Medicine, जिसको शॉर्ट फॉर्म में NLM कहते हैं, are best known databases for biomedical journal literature. Third है assessing the validity and usefulness of the evidence. To assess the validity of the evidence, the source of bias must be considered. Bias can be result in overestimation or underestimation of the effectiveness of the drug therapy. Four sources of bias possible in clinical trial are selection bias, performance bias, attrition bias, and detection bias. 4 bias are based on the validity of the evidence. The physician has to make a clinical decisions. Fourth point है applying the results to make clinical decisions according to the patient's situation. Many patients have a specific factor must be considered while applying the result. First है identification of the disease state and stage. दूसरा है baseline risk characteristic of the disease. Third है the patient's values. Thus, ABM helps the physician to arrive at proper clinical decisions. तो हम लोग जो पढ़े वो ABM के बारे में पढ़े, और इसी तरह से आप लोग चाहते हैं तो इस वीडियो पे बने रहें, इस चैनल को सब्सक्राइब कर लें